Good evening and welcome to Family Values Alliance Ballarat, and tonight we're talking about gender dysphoria and social contagion. Now, I thought rather than having a really complicated DSM-5 explanation for what gender dysphoria is, I've pulled up a Psychology Today definition for you. It's a little bit easier to digest. So, gender dysphoria, which was formerly known as gender identity disorder, is defined by strong, persistent feelings of identification with the opposite gender and discomfort with one's own assigned sex. The term assigned sex, that's a deliberate abuse of language. Actually, I'll just mention here, we have a biological sex. We're not assigned our sex at birth by the doctor saying you're a boy or a girl. We actually have a biological sex. This disconnect between your birth sex and your feelings results in significant distress or impairment. People with gender dysphoria desire to live as members of the opposite sex and often dress and use mannerisms associated with the other gender. For instance, a person identified as a boy may feel and act like a girl. This incongruence causes significant distress. So it's not just a little bit of uncomfortable, but significant distress. And this distress is not limited to a desire to simply be of the other gender, but may include a desire to be of an alternative gender. So that's their explanation. One of the concerning things I've noticed is now they are pushing for transgender surgeries with the person not even having to feel any of that distress. So they've gone from it being transgender because they've got so much distress, they absolutely have to have it to be able to live, to the point now where they say, well, it doesn't necessarily need to have a lot of distress. They just really believe that they're a boy born in a girl's body or a girl born in a boy's body. They are really pushing to make transgender surgeries common and easy. The American College of Pediatricians has come out with a statement regarding the harm of gender ideology on children and young people. And one of the things they talk about is how gender is a sociological and physiological concept. No one is born with a gender. Everyone is born with a biological sex. Gender, an awareness of oneself as male or female, is a sociological and psychological concept, not an objective biological one. No one is born with an awareness of themselves as male or female. This awareness develops over time and, like all developmental processes, may be derailed by a child's subjective perceptions, relationships, and adverse experiences from infancy forward. People who identify as feeling like the opposite sex, or somewhere in between, do not comprise a third sex. They remain biological men or biological women. Who would have thought that it would be so controversial to say that men are men and women are women? Who would have thought we would come to the point where that's a really controversial statement? And yet here we are, where controversy surrounds what we've known throughout the ages to be true. Just a little bit about the history of the transgender movement, and this is written by Walt Heyer. Walt Heyer, he had a lot of dysphoria throughout his life, and he transitioned to becoming a female, Laura Jensen. And his problem was that when he did therapy after 8 years of dealing with this as a female and then transitioning back to a man, he realized the root of his cause was in things such as his grandmother dressing him up in this little pretty dress and saying, "Oh, what a lovely little girl," when he was 4 years old. And when he was a boy, he would be scolded. And so he came to dislike himself as a male due to the abuse of his grandmother, which is not uncommon. There's often an element of abuse somewhere within that. So he talks about it as the first setting for transgender surgeries, mostly male to female, was in university-based clinics starting in the 1950s and progressing through the 1960s and the 1970s. When the researchers tallied the results and found no objective proof that it was successful, and in fact evidence that it was harmful, the universities stopped offering sex reassignment surgery. Since then, private surgeons have stepped in to take their place without any scrutiny or accountability for their results. Their practices have grown, leaving shame, regret, and suicide in their wake. That's quite a powerful statement coming from someone who was transgender. And he's done a lot of research because he actually really wants to help others who are traveling down the same path as him. And it seems that when someone has some gender confusion, they're automatically steered into having a transgender surgery, and other causes, other potential reasons for their disconnect are not explored. They're not given an opportunity to look at reasons for the way they feel they do. I want to share with you a false assumption of gender ideology that we hear. This is actually from the Safe Schools Coalition material. So this is stuff that will be taught to our children in our primary schools and secondary schools here in Victoria. What they teach is we each have our own unique identity or way we think and feel about ourselves. There are three in particular that help us build our identity. The sex we were assigned at birth. Notice again, instead of saying the sex we are born as, they're saying assigned. No, we're not assigned. We are born as male and female. Our gender identity and our sexual identity. Gender isn't quite as simple as whether you're male or female. Everyone has their own gender identity in relation to masculinity and femininity. Some identify with both and some don't identify with either. It's up to the individual to describe what gender identity fits them best. So you can see any child who has a little bit of confusion about the way they are, for any reason, they will buy into that lie. Oh, it's because I'm a girl born in a boy's body, or I'm a boy born in a girl's body. And since this teaching has been in schools, we're having huge numbers of children identified and sent to gender specialists. And I believe a hospital that had one patient 10 years ago had 254 patients last year. So really, it's exploded if you look at where we were at and where we are now. The best way to explain how social contagion has taken over, how people have been socially brought into the idea of a boy born in a girl's body and a girl born in a boy's body, is to actually look at some real people and a few of their experiences. If you Google Detransition in YouTube, you will actually come up with hundreds of people who have bought into the lie that they were transgender and then either stopped the process or they've gone through but then they've detransitioned to being their sex they were born, their biological sex. Carrie says, I'm seeing a commonality in that our decision to be a boy or a man, whatever that means, was a result of trauma associated with our female bodies. So she knows several other people who were detransitioning, who had started to transition from female to male and then decided, no, I'm not, and have detransitioned. And she says there was just so much pain that I endured as a woman. And she talks about how people who detransition are not welcome in the trans community. And so part of the reason we don't hear a lot of their stories is because if they speak out, they are shamed into silence. However, a lot of young people are getting courage. They're putting their stories out there on YouTube. I think they want to really genuinely let others know this might not be the right path for you. Think about it before you take this path. She also talked about that there is not a whole lot of clarity on what we call dysphoria is, what it actually means. She says that she thinks it can lead to a lot of things being interpreted as dysphoria that might have other explanations. And so she says it's valuable to explore your dysphoria, take some time to sit with it, what kinds of feelings you have towards your body, where the disconnect is. Is there some reason that you might be experiencing it? And then she says, in her experience from her own life, from talking to other dysphoric females, all the detransition women, it's maybe genetic, maybe environmental, maybe a mix of the two. A few things that women I know have identified as part of their dysphoria are things like sexual trauma or eating disorders, dissociative disorders, mental health issues, parental abuse, partner abuse, lesbophobia. So she names about 6 different potential areas for her reasons for feeling dysphoria about her gender, 6 different reasons that people might feel dysphoria about their gender, and why it's not a good idea to push someone straight into the transgender. Okay, you're identifying as this, we're going to affirm that, we're going to give you this, we're going to treat you that way. As Carrie pointed out, the transgender lobby actively polices and suppresses discussion of sex change regret and claims it's rare, no more than 5%. However, if you do decide to detransition, to once again identify with the sex in your DNA, talking about it will get you targeted by trans activists. Now, I just want to point out, trans activists are only a really, really small minority of the LGBTQI community. And we need to make a clear distinction, because a lot of people think you're against all transgender people. No, there are actually activists, maybe 1%, maybe even less, that are pushing the agenda. So it's a challenge to understand the scope of regret for sex change surgery. It's out there, and that comes from an article that Stella Morabito has written. So a few more quick stories of people who've detransitioned. This person talks about how I've lived my life for a year as a female. My whole family reached out to me and told me they still loved me. In the way they share their story, it seems obvious that there was no stigma, and there was actually very little questioning about his decision to change to become female. So no one actually really questioned it. Okay, that's what you are, we're going to support you and affirm this. That took them on a journey. A year later, they're talking about, there were 3 pills that I was taking. One was estrogen, one was progesterone, which is something that helps fight cancer from the estrogen, and the 3rd drug, spironolactone, which is very damaging to other organs over a long period of time. These are drugs that they would have to take every day for the rest of their life if they transitioned. So why go out of my way to damage myself? Force my body into something that's very unnatural because of some pharmaceutical drug that some doctor is telling me what I need. And so they came to the realization, you know, these drugs were harmful, they were hurting my body, and I don't want to have to take these every day of my life. And that's what actually made them realize, you know what, I'm going to do the journey to be comfortable in my own skin, in my own sex. Jaya talks about when she went for her top surgery consultation, okay, so where she was going to have her breasts removed, that brought on an existential crisis where she actually sat down and had a long, hard thought about the process of what she was doing. She started to question whether medical transition was really for me. I've noticed recently that medical transition has been counterproductive, and it's been creating gender dysphoria where beforehand it never existed. That's a very interesting comment, isn't it? Mm. She also goes on to say, testosterone was making me very angry, very irritable, and I'm not that sort of person. I do want kids, if she'd continued at the path she was going, she would have become completely sterile, no opportunity to have children. And transition isn't going to give me that. So we have another story of a person and some of the reasons why. Now, those stories actually highlight one of the things the American College of Pediatricians has been saying, and that is that puberty is not a disease and puberty blocking hormones can be dangerous. Reversible or not, puberty blocking hormones induce a state of disease, the absence of puberty, and inhibit growth and fertility in a previously biologically healthy child. Here we have another person talking about their experience, and you know, these are very brave young people, and I just take my hat off to their bravery and vulnerability in sharing their stories. And she says, I'm a real live 22-year-old woman with a scarred chest and a broken voice and a 5 o'clock shadow because I couldn't face the idea of growing up to be a woman. She says further in her video, she detransitioned because I can't keep running from myself, disassociating from myself, because acknowledging my reality as a woman was vital to my mental health. I'm happier because I detransitioned. Transition is not the only way or even the best way to treat gender dysphoria. So these young people, they're actually coming out with some quite profound truths. She talked about how testosterone made her even more dissociated than she already was. Dylan, he was 13 to 21 when he identified as a male. She. Okay, talks about being a typical tomboy and, you know, hated floral dresses and felt really uncomfortable. And because of not fitting the norm for a girl, felt like, well, I obviously need to be a boy. And part of that is pushed by the belief, you know, that there can be a girl born in a boy's body, as opposed to, hey, you know what, some people are just tomboys. You don't have to like floral dresses to be a girl. You don't have to like dolls to be a girl. You can drive a truck and still be a girl. Those things are normal for males and females. But sadly, she felt pushed into the mold because she was different to the norm. She talks about how she's noticed recently that medical transition has been counterproductive and it's creating dysphoria where beforehand it never existed. I recently heard a story from a pediatrician who's been long-term practicing, and they were saying how there was a young boy who had dysphoria and really felt like he was a girl. So they went to start talking to a counsellor. Now, this is many years ago, before the transgender movement took off the way that it has today. And they did some family counselling. What had happened in their family is when he was 3, his younger sister was born with a disability. Very good family, very good parents. But with a child with a disability as a new baby, you can imagine how the focus gets taken away. And there came a day when this young boy said, "You don't love me when I'm a boy. You only love me when I'm a girl." Now that was the turning point for him coming to accept himself as who he was, and the parents affirming him for who he was, because they realized that was due to that confusion. Now, if there was a child that was feeling that way, playing with dolls at 5 and identifying as a girl, they would be rushed straight into the transgender line. They wouldn't even explore the psychological causes. And that was the point the pediatrician was making, that it's actually really dangerous that we're not looking at what's going on in the whole context of the person's life. Why you hate, read Detransitioners, okay? She writes, she says, "Because I realise now that these women were speaking from a very deep shared experience with each other and with me. And it wasn't just the shared experience of dysphoria or having some random medical condition. It was the experience of being female under patriarchy, that having dysphoria, that hating my body, that hating being female, not wanting to be a woman, that this was a female experience and this was a way. Transitioning was, and identifying as transgender, was a way that females dealt with the pressures that females are subject to under patriarchy. And once I realised that, I knew that if I just let myself be honest with myself, that if I were to transition, I would end up feeling exactly as they did. And if I didn't let myself be honest about what I had experienced and where this dysphoria came from, then I could transition. But the only way I could be able to hold myself together would be constant dissociation, constant lying to myself, constant pretending, constant subsuming everything I felt underneath a narrative I didn't believe. So she started the process of becoming transgender and just realized it wouldn't make me happy. I'd be living a complete lie. The next person I want to talk about, this is in the context of an interview that was being held with Carrie, a 22-year-old woman who had previously identified as a trans man. And she was asked the question, did any counsellors there attempt to explore whether there might be other underlying issues which could contribute to you claiming a transgender identity? Was there ever a concern that other mental health problems could interfere with a successful transition? And she responds, my counsellor did not explore this with me, other than what seems to be the standard cursory question of, would you be able to be happy being a butch lesbian? Or something along those lines. It seems like everyone asks this question thinking it's somehow going to help dissuade people who are transitioning for the wrong reasons. But with all the other positive things that are said about transition, it really doesn't work. I didn't know that I was a lesbian until after I had started to detransition, primarily due to dating trans men. So this question didn't strike me as relevant at the time, and there wasn't any discussion of alternative ways to deal with sex dysphoria. And she further goes on when she's asked the question, suicide risk is often given as the main reason children and teens should be affirmed in their trans identity. What do you think about that? I think it's something to approach with caution. Suicide risk is a good reason to treat a lot of mental disorders and medical conditions. And I think the fact that gender dysphoria is one of those disorders is not necessarily cause for alarm. Someone being a suicide risk without psychiatric medications is a good reason to give them psychiatric medications. Someone being a suicide risk because of neuropathic pain, which isn't likely to physically kill you, is a good reason to give them pain medicine. Someone being a suicide risk due to feeling disconnected from their physical sex can, I believe, be a good reason to give them cross-sex hormones and surgeries, provided other courses of action have been examined in an objective way, and having really looked at those other options, medical transition still seems to be the best choice. So in other words, she only believes if we've looked at the other options, other courses of actions, and have examined those in an objective way, then maybe we can look at the other, but not before those other ones are explored first. She goes on to say, what I think is more concerning is the trans community's tendency to present suicide as basically the only alternative to transition, and to martyr trans individuals who do commit suicide. And basically that's something that we've had to deal with, is whenever someone questions, are we really going the right way in quickly pushing people into transgender surgeries, the first thing is, how can you be so heartless? You're causing people to suicide. And really that's emotional blackmail to stop you from questioning some processes that really need to be questioned. Because of that, there's this myth that higher rates of suicide are because of stigma. They've actually done some research, and the rates of suicide are 20 times greater among adults who use cross-sex hormones and undergo sex reassignment surgery, even in Sweden, which is among the most LGBTQ affirming countries. Even where it's been accepted for a long time, the outcomes are still really bad for people who transition. And it is believed by many that that's because we're not dealing with the psychological causes for the dysphoria. I recently heard that there's actually a higher rate of suicide among those that do transition than there is among those that don't transition. You will commonly hear, if you question, are we doing the right thing with pushing someone straight to transgender surgery, you're going to cause them to suicide. And that's actually very deliberate by the trans activists, that really small percentage, the ones that don't want you to question it. Because if you question it and you think about it, we know feelings are not facts. Feelings are not objective reality. There's a teen therapist in the US, her name is Sasha, and she talks about how she uses non-judgmental, compassionate dialogue that focuses on exploration rather than immediately seeking to affirm and transition your child. Together with your teen and family, we consider multiple complex factors that may contribute to their dysphoria, including social, cognitive, environmental, physical, and emotional factors. Treatments may include mindfulness, somatic and integrative techniques, as well as confidence building and age-appropriate sexual identity exploration. I also educate parents about the topic of gender identity, break down stereotypes, discuss risks, and encourage parents to become deeply invested in the process so they can best support their child outside of therapy sessions. While transition may be the best option for some kids, many others have had very painful and negative experiences with their transition, and I help families prevent this from happening. I believe I owe it to your child to be thorough and careful in my approach, placing safety, well-being, and happiness above all else. There's been a lot of questioning by different people with other mental health conditions. Why is it that gender dysphoria is automatically treated as the person with the dysphoria is right, that the false belief is correct? Moira Fleming writes in The Federalist, why is transgender an identity but anorexia a disorder? I approach this topic with a wrenching awareness of what it feels like to be disconnected from your body, to hate with every fibre of your being the way you look in the mirror, and to be willing to undergo great feats of self-mutilation to achieve a vision that is always just out of grasp. My perspective on the matter, however, probably would not go over well among most LGBTQ individuals. As a person who has struggled with anorexia nervosa since puberty, the transgender anguish resonates with me. The similarities between the two illnesses are striking. Yet one is an identity and the other is a disorder. Why? Very good question. Feelings are not facts, and the way that it's talked about in the 10 common thinking distortions is emotional reasoning. And emotional reasoning is when we assume feelings reflect fact regardless of the evidence. The idea here is, I feel it, therefore it must be true. And I've got a picture here of Dennis Avner, who is known as the Cat Man, and he had the most surgeries to modify his body to look like a cat as much as he possibly could. It's actually another sad story because that wasn't reality, and he died alone by suicide in a garage. probably partly the result of all the money that he spent on the surgeries changing his body. And so the lie that he tried to live wasn't the truth, and in the end it ended in suicide. Realize that feelings, irrespectively of how real they are to you, are not objective facts, and that's what we teach in mental health. And so to me, I can't understand how, when we know in mental health this to be a universal truth, that feelings are not facts, that when we buy into that, that it creates emotional distress, why the mental health field has brought into so much of the transgender movement. The American College of Pediatricians writes, "A person's belief that he or she is something they are not is, at best, a sign of confused thinking." And I think for a lot of children, that's really what it is. It's confused thinking because they've gone to school and we know they're putting books out there. No one can tell you if you're a boy or a girl, only you know. So kids are getting confused because this teaching, it's very confusing for young children. When an otherwise healthy biological boy believes he is a girl, or an otherwise healthy biological girl believes she is a boy, an objective psychological problem exists that lies in the mind and not the body. And it should be treated as such. These children suffer from gender dysphoria. Gender dysphoria, as we've talked about, formerly listed as gender identity disorder, is a recognized mental disorder in the most recent edition of the Diagnostic and Statistic Manual of American Psychiatric Association, the DSM-5. The psychodynamic and social learning theories of GID have never been disproved. Walt Heyer, who I spoke about earlier, makes a statement that while he was studying psychology in a university program, I discovered that trans kids most often are suffering from a variety of disorders, starting with depression, the result of personal loss, broken families, sexual abuse, and unstable homes. And when you think about it, we're hearing horrific stories about the rates of domestic violence in society, the rates of sexual abuse, 1 in 3 girls, 1 in 4 boys. So there's a lot of abuse and trauma around us. And those are reasons in and of themselves for a lot of trauma leading to gender dysphoria. Actor Rupert Everett said, "I really wanted to be a girl. Thank God the world of now isn't then, because I'd be on hormones and I'd be a woman. After I was 15, I never wanted to be a woman again." Children's feelings change. Of the boys and girls seen in clinics like Dr. Zucker's, a high percentage, up to 80% in a study of 44 gender dysphoric boys, grew up to be not transgender, but bisexual, gay or lesbian adults. Thus, helping prepubescent children feel comfortable in their birth sex makes more sense than starting a lifetime of hormonal treatments and surgeries that will in all likelihood turn out to be unnecessary and unwanted. And that was Deborah So from the Wall Street Journal who wrote that. Another disorder that could be compared is body dysmorphic disorder. And Dr. Paul McHugh, the former psychiatrist in chief at Johns Hopkins Hospital, writes, "With body dysmorphic disorder, an often socially crippling condition, the individual is consumed by the assumption, 'I'm ugly.' These disorders occur in subjects who have come to believe that some of their psychosocial conflicts or problems will be resolved if they can change the way that they appear to others. For the transgendered, this argument holds that one's feeling of gender is a conscious, subjective sense that, being in one's mind, cannot be questioned by others. The individual often seeks not just society's tolerance of this personal truth, but affirmation of it. Here rests the support for the transgender equality, the demands for government payout for medical and surgical treatments, and access to all sex-based public roles and privileges." that was in an article that talked about how transgender surgery isn't the solution. A warning from the American College of Pediatricians: children who use puberty blockers to impersonate the opposite sex will require cross-sex hormones in late adolescence. Cross-sex hormones, testosterone and estrogen, are associated with dangerous health risks, including but not limited to high blood pressure, blood clots, stroke, and cancer. And so many, when they go through school and they're being given this information about transgender and it looks quite trendy to be transgender, they're not actually told that you'll be on these hormones every day for the rest of your life, and there's a high risk of cancer, or there's a high risk of other things. And I honestly don't believe that the long-term effects of estrogen and testosterone have actually been fully explored. I believe there's probably a lot of other risks that are unknown at this point as well. In our Safe Schools curriculum, just to see where we've been going with safe schools, okay, they say gender. Where possible, avoid using gendered terms. For example, use words like workforce instead of manpower, and police officer instead of policeman. Phrases like ladies and gentlemen and boys and girls should be avoided. When speaking about individuals, be sure you know and use their preferred pronoun: she, he, they. If unknown, ask that person or use their name instead. We're actually moving away from male and female, and we're moving into lots of other generic terms. And quite sadly, even in Australia, there are some quite major changes that many aren't aware of. I believe in the ACT on a birth certificate, you can now choose male, female, or other. I'm not sure what the other means. So you can already choose not to be male or female on your child's birth certificate in the Australian Capital Territory. I was reading an article written in Canada, and the author of that particular article, they would be an extreme trans activist, but that's where things are heading as people are listening to them, is doctors shouldn't be saying, oh, it's a boy or it's a girl, because that's creating a gender stereotype. They should not have gender on any child, because that could be creating trauma for the poor child. Intersex is quite different to transgender, and we need to make a distinction. Someone who's intersex, there's physical deformities of some kind. There is a physical issue. They might have been born with both estrogen and testosterone in their body. That does happen with some people. That can be told through a test, through a blood test. They might be born with different parts of both sexes, male and female. That can be told medically identifiable. It's not a problem in the mind. It's completely different, and it's very, very rare. And we need to make sure we do not confuse intersex with transgender, which unfortunately is one of the reasons why they've justified rushing people into affirming transgender, is because there are intersex people. It's completely different. It would be like saying someone who has panic attacks needs a heart operation because some people are born with a hole in their heart. That doesn't make sense. The psychological condition is completely different. It's a condition of the mind to someone born with that physical defect. Now, I just want to introduce you to Nevo. He's one of our pin-up people in the Safe Schools curriculum. He's the transgender example. And in the curriculum, it talks about him being a positive and confident young person with the same hopes and dreams as many young people. He tells a powerful story about growing up with the knowledge that the female sex assigned to him at birth, here we have again the lie, they're assigned at birth, did not match who he knew he truly was. He believes he's transgender, and he's talking about that in the Safe Schools curriculum. Now, a few years later, and Nevo has actually written his own book. I look in the mirror and I see I'm neither male or female. Nevo is now identifying as genderless. And you'll hear people talking about being genderless. I'm not male, I'm female. Or some days I wake up and I feel like I'm a woman. Other days I wake up and I feel like I'm a man. And this is how you should just accept me, because that's my reality. So you need to accept that. He talks about, while it's exhausting to be a walking search engine, the book is a chance to reach young people like himself undergoing the transition and bring more trans stories into the mainstream, because he maintains gender diversity needs to be normalized and understood. One of the things it talks about in the description is that Nevo is now a youth worker and he's teaching young people about being genderless. So now young people are hearing from Nevo, children and young people, about what it is to be genderless and to be trans. And so they are having a problem of the mind identified as if it is truth. This is from the UK, but we're not far behind them, maybe 3 or 4 years behind them, so it's good to be aware of what's happening over there. This was written in an article in a newspaper after parents received a letter from the school. They were asking children as young as 4 to choose what gender they are before they start school, with the option of being something other than male or female. Parents received the letter asking them whether the child preferred male or female. It said, please support your child to choose the gender they most identify with. One furious mother hit back at the council and said, treating children as though they are adults is a dangerous approach from a safeguarding view. The letter read, we recognise that not all children and young people identify with the gender they were assigned at birth. Here we have it again, not born with, assigned at birth, or may identify as a gender other than male or female. However, the current systems, set nationally, only record gender as male or female. Please support your child to choose the gender they most identify with. Or if they have another agenda they identify, please leave this blank and discuss this with your child's school. Parents have criticised the move, claiming children should be allowed to enjoy their innocence. I fully agree, they should be allowed to enjoy their innocence. They also described it as a dangerous approach, since 4-year-olds do not have an adult view of the world or fully understand gender roles. Very concerning that children from 2 years old are being taught that their biology is not fixed, that the sex they are born with is not fixed. And so you can see why we are having a lot of social contagion in our society. And there are professionals who are very concerned, but they're scared to voice their concern because they're afraid of being labelled transphobic if they actually speak out and say, I'm really concerned about this quick affirming people who with gender dysphoria to be transgender. You know, it's a medical solution to a psychological problem. The problem is psychological, therefore it needs to have a psychological exploration and resolution. The American College of Pediatricians states, conditioning children into believing a lifetime of chemical and surgical impersonation of the opposite sex is normal and healthful is child abuse. The American College of Pediatricians urges educators and legislators to reject all policies that condition children to accept as normal a life of chemical and surgical impersonation of the opposite sex. Facts, not ideology, determine reality. And that's what we need to remember, that facts, not ideology, determines truth. And we need to keep saying this and keep reminding people. Thank you so much for coming this evening. There's a lot more that I could say, but I'm sure that in our question and answer after time, we can have a bit of a discussion around that. Thank you so much.